If you're someone who struggles to get enough phosphorus in your diet, K-Phos Neutral might be a good option for you. Phosphorus is a crucial mineral for bone health, as it helps with building and maintaining strong bones. It also plays a role in regulating the amount of calcium in your body and urine. It's important to take this medication as directed by your healthcare provider, and they can advise on the best time to take it and the appropriate dosage for your specific needs. When taking K-Phos Neutral, it's important to follow your doctor's instructions. Typically, you'll take this medication 4 times a day with meals and at bedtime, and always with a full glass of water. After taking it, make sure not to lie down for at least 10 minutes. Consistency is key when taking K-Phos Neutral. Try to take it at the same times each day to get the most benefit from it. Your doctor will determine the right dosage based on your medical condition and how you respond to the treatment. It's important to avoid taking any products containing magnesium, aluminum, or calcium within 2 to 3 hours of taking K-Phos Neutral. This includes certain medications, vitamins/minerals, antacids, dairy products, and calcium-enriched juice. These products can interfere with the absorption of K-Phos Neutral. Always take this medication as prescribed by your doctor. Do not change the dosage or frequency without consulting your doctor first. Some common side effects of K-Phos Neutral include nausea, vomiting, diarrhea, dizziness, or headache. If these effects persist or worsen, notify your doctor or pharmacist. This medication is prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. When you first start taking this medication, there is a chance an old kidney stone will be passed. Notify your doctor immediately if you experience any serious side effects, such as bone/joint aches, muscle cramps, stomach pain, swollen hands/legs/feet, confusion, fast/irregular heartbeat, seizures, unusual weakness, tingling/numbness of the hands/feet, or signs of kidney problems, such as change in the amount of urine. A serious allergic reaction to this drug is rare, but seek medical help right away if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects, contact your doctor or pharmacist. In the US, call your doctor for medical advice about side effects. In Canada, call your doctor for medical advice about side effects. Before taking K-Phos Neutral, it's important to inform your doctor or pharmacist about any allergies you may have. This medication may also contain inactive ingredients that could cause allergic reactions or other issues. It's best to talk to your pharmacist for more details. It's also important to discuss your medical history with your doctor or pharmacist before using K-Phos Neutral, especially if you have high levels of phosphate, potassium, or sodium, adrenal gland problems, fluid retention, bone issues, heart disease, high blood pressure, kidney or liver disease, muscle problems, pancreatitis, late pregnancy problems, dehydration, severe burns or wounds, or if you are on a special diet. Since K-Phos Neutral contains sodium, it's important to consult your doctor if you are on a salt-restricted diet or if increased salt intake could worsen your condition, such as in the case of heart failure. Older adults may be more sensitive to the side effects of this medication, especially swelling in the legs and feet due to sodium and water retention. If you are pregnant, K-Phos Neutral should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It is also unknown if this drug passes into breast milk, so it's best to consult your doctor before breastfeeding. Remember to always follow your doctor's recommendations and advice regarding the use of this medication. It's important to be aware of potential drug interactions with K-Phos Neutral. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with K-Phos Neutral include aspirin, burosumab, digoxin, eplerenone, high blood pressure drugs, potassium supplements/salt substitutes, vitamin products, and certain water pills. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless your doctor instructs you otherwise. Ask your doctor or pharmacist for more details about any potential interactions. If someone has taken too much K-Phos Neutral and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. For residents of Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe diarrhea and muscle spasms. Always seek medical help if you suspect an overdose. It is important not to share K-Phos Neutral with others. Your doctor may also recommend certain lab or medical tests, such as checking your calcium, phosphorus, potassium, and sodium levels, as well as your kidney function, while you are taking this medication. Make sure to keep all of your medical and lab appointments, and consult your doctor for more details. Remember to never share this medication with others. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take 2 doses at the same time to make up for the missed one. Remember to store K-Phos Neutral at room temperature, away from heat, light, and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to discarding the medication, make sure to follow the instructions from your pharmacist or local waste disposal company. It's also important not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. And remember to properly discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.